something that would be certainly useful would be, first of all, to consider the problem. So polypharmacy is something that is not observed sometimes. So first of all, think about polypharmacy and to know that polypharmacy may have impact in relevant outcomes in the MS population, and something that neurologists who treat MS patients should take into consideration would be to review their medications and to at least once a year to review each patient's medication to see if patients need to continue taking the medications that they're taking, because something that has been described outside the MS world has been a concept that it's called therapeutic inertia. So a lot of patients start on medications, and after a couple of years on remaining on those medications, maybe the indication for these medications is no longer necessary, but there's a certain inertia on continuing the medication and not making changes. And that sometimes may be something that would add on medication burden. And also considering if all possibilities of non-pharmacological treatment have been analyzed, because a lot of the treatments, for example, for to try to treat symptoms of MS, such as fatigue, for example, neuropathic pain or spasticity, may have an available option that is not necessary, or at least would be useful to try to treat it with non-pharmacological measures. So to explore the possibility of treating patients or at least approaching patients with non-pharmacological measures would be something that would at least reduce the burden of polypharmacy.